in a tie situation for an ordinance vote, the mayor can cast the deciding vote. I vote in favor of this ordinance. Meeting adjourned.
Obviously, 90% of people here don't want it. The others told me not to come.
Sharon Leffers, and your definition of a mandate, would you please tell us again what that is? In your estimation, what that is, please.
It's the words we use to say we want to have the masks that would be an enforceable item to wear in the city of Columbus.
And so are you saying it is a law?
It's made a law by an ordinance. That's why we're having the meeting here today.
So the ordinance is making a law to mandate masks?
Yes, ma'am.
My question then, second question, then I'm done. How do you plan on enforcing that law? If somebody tattles on the neighbor and says, oh, looky there, how are you enforcing
That
this?
question was asked earlier.
I missed that, I'm sorry.
Right, and I did state that it is an enforceable law. There is a fine that goes with it. We had talked about how other communities have looked at this, which we reached out to and talked to. So if there is a complaint, if it is something the police have to go check on, and I'm sure there will be some, then they will first try to educate those people with the fact that it is a law, that it is something they need to do.
I have one question.
Yes, sir, and then I am going to stop the questions at this point.
Why can't we hear from everybody? I mean, we're the...
My name's Steve Lloyd. If masks work so well, how and why can Nancy Pelosi get a haircut not wearing a mask?
Good question.
I would ask anybody here that is opposed to an ordinance to please raise your hand. Please, I'd ask the city clerk to please note the people here.
You might want to count so you get an accurate representation.
I think we have a great count. I think we're good.
I am here representing the East Plant for BD 910 North 14th Street.
Yeah, and I guess before I read the letter, I just want to say, I appreciate everybody's input, everybody's feelings, and we're not here to tell people how to feel, but obviously as a big employer in town, and, again, trying to make medical products that save lives every day, we've got some communication from our corporate. So dear Mayor Bulkley and council members, on behalf of BD and our 2100 associates of Columbus, respectfully urge you to approve the emergency facial covering ordinance under consideration. Across our community, our state, and the world, we are continuing to battle the effects of COVID-19. At BD, we are no different and have the added responsibility of maintaining continuity of operations so that we can deliver life-saving products at a time when they are truly needed most. The virus is having a significant impact on our employees, and while we are doing everything in our part to help prevent the spread of the virus, we are asking for help.
But I was actually at home, but I was compelled to get in the car and come up here. I work at Meridian Gardens Assisted Living. And obviously I'm touching my mask right now. This is not about touching the mask, civil liberties, studies. This is about doing what we have to do to slow the spread of the virus. And I say that because for the last 9 months, day in and day out, our staff have been living through this, and it has been hell on earth. I have seen some of the kindest, compassionate nurses leaning up against a wall in full PPE, in tears, bawling, because they don't know if they can continue to work in the line of work they're working anymore.
How do you feel about the people y'all won't let out of the family seeing them?
Dying for
Exactly, and
loneliness.
exactly, and my point is, you guys, if we can slow the spread in the community, then we can relax those restrictions. Everything, we have the meetings, the hours and hours of meetings we've had on this, day in and day out, about how we can let folks see their loved ones and yet keep them safe. You know, and they're exact opposites. COVID has targeted nursing homes, assisted livings, hospitals, and I imagine the reason that no one from the healthcare community is here is because, first of all, we're all told to go home. You know, I go to the store once a week, I get gas in the car, I haven't been out and about in months. That I don't know how to, it's as simple as just, you know, if you can throw a mask on when you go to get gas or go into a store, and we can slow this down, because I'm telling you, for our residents, when we have to go into isolation mode, and I now probably, because I've been here and been in such high exposure with folks that are not socially distancing and folks that are not wearing a mask, I'll probably have to stay home from work for the next 10 days. That's just the rule. But I was compelled to come up here because we really want this to end, you guys. It's miserable.